I'm Eileen Dower with St. Cloud Ear, Nose, and Throat, and I'm here to talk to you a little bit about what to expect after tonsillectomy or tonsillectomy and adenoidectomy. This is one of our most common procedures, but it can be one of the more challenging recoveries, and so this may be a worthwhile review for you prior to your surgery. The first thing you should know is that pain after tonsillectomy is variable, but can be somewhat intense. It is a bit of a roller coaster from one day to the next, and while you may have a good first 2 or 3 days, it often will worsen before it again improves. The time frame when tonsillectomy is usually at its most intense is typically days 2 through 7. You'll find that during this time frame, the scabs begin to come off and the pain is more intense. It also is a time when bleeding risk is at its peak. We recommend that you follow your doctor's instructions. For our younger children, we typically provide ibuprofen and Tylenol as an alternating pain relief scheme. For older children and adults, we typically add a narcotic such as hydrocodone and oxycodone. For our older children and adults, we typically recommend avoiding excessive use of ibuprofen because of an increased bleeding risk. That bleeding risk does not seem to be as important in younger children. One of the aspects of recovery for everyone, but especially younger children, can be dehydration. And so it's important to remember to stay well hydrated after tonsillectomy. Solid food is something that can be avoided for the first few days and can be reintroduced as the throat is more comfortable. We expect that you will have some weight loss after tonsillectomy, but virtually everyone regains this weight within a few weeks after their recovery is complete. What do you do if you have a significant problem? What do you do if you have bleeding or if you are concerned about dehydration? Please call us. We answer our phone 24/7. Our nurses are available during the day to answer your questions or get in touch with your physician. After hours, you can reach the on-call physician and they can help you troubleshoot any problems. When in doubt or if there are concerns, please feel free to go to your local emergency department. Finally, most importantly, if you have any significant bleeding, please remember that this is common, but if it's beyond a couple of tablespoons, you need to be prepared to go to your local emergency room. If you have bleeding that is a small amount but persistent, we recommend taking ice water in the back of your throat if possible, or in younger children, something like a popsicle. Hold it in the back of your throat and swallow. If the bleeding persists more than approximately 30 minutes, just present to the local emergency department or at least call your physician. Typically, this bleeding stops on its own, but if it doesn't, occasionally we need to take our patients back to the operating room to control it. We hope that your recovery is not too terrible, and we expect that in the end, it will be a good decision for you and your family to have had your tonsils removed.